this is instability, and so this is the front of. Well, so we number the vertebral body. So that'd be C1, cervical spine 1, 2, 3. Let's see, 1. That's actually, this is 2, 3, 4, 5. Anyway, you can see that this one sits way forward compared to this one. See that step off there? And you can appreciate here that there's narrowing. And this is an MRI of the same child. This is a CT scan, which shows our bones real well. It doesn't show the soft tissue. And this is a boy with MPS 6. Okay, he's only 2.5 years old at the time of this. And here you can see this black line here, this thickening. Okay, that's dural thickening. And then also this child not only has the narrowing from his dural thickening, but he also has instability. So he has very little room right there. Okay? And you can see that little white blush in there. That's where the spinal cord has been bruised, because this boy was just minding his own business. He fell back, hit his head, and boom, he hit his spinal cord. And luckily he recovered all his function, but he was temporarily paralyzed from this. So this is something that's very concerning for us as healthcare providers, but more so for parents and patients who have this problem. And so this child ended up having to have surgery to not only decompress that narrow there, but also we had to take out this bone so that he had. We had to take out that bone to decompress the narrow, but we also had to fuse his spine so that the pieces wouldn't move abnormally on each other. Okay. Now, there's some information out there with Hurler syndrome after stem cell transplant. So here's where I was talking about that peg again. Okay. And the peg should come all the way up to here. So you can see this is what we call hypoplasia or underdevelopment of the odontoid process. And it's universal in MPS disorders, including MPS 1. And right now, if you read the literature, it says that this ossifies by 3 to 5 years of age, or after a transplant, and that they don't have any cervical spine problems. But I can already tell you that I know of 4 children with MPS 1 after transplant who have had to have cervical spine surgery. Okay? And so it's really important that we follow all children with MPS disorders, even those that have had transplants, to ensure that they don't develop stenosis or instability. So you may be wondering, well, how do I know if my child has these problems? Well, in really young babies, they are what we call hypotonic. So they're just kind of floppy. They lay there. They don't move very much. I will tell you that it's very, very uncommon for babies with MPS disorders to have cervical spine. The youngest that I know of are sort of in the 2.5 to 3 years of age. What's more commonly you'll see is what we call myelopathy. Myelopathy just means bad nerves, okay, in the spinal cord. And what we see there is weakness, clumsiness, an unsteady gait, or changes in bowel or bladder function, which can be difficult to ascertain if your child's in a diaper, but they can either retain or more commonly they just lose function. So this is obviously something you see more in be more aware of in a child who's potty trained. But when they walk, they get an unsteady gait. What that looks like is their feet kind of come further apart, and because they need to balance themselves, they have a hard time balancing. You'll see changes in their hands, so clumsiness and weakness. So they'll be pretty good writers with a crayon or a pen or a pencil. They eat with a fork, a spoon, and all of a sudden they're having a harder time holding onto those. They can't feel it, or they don't have the strength to hold them anymore. So they lose dexterity. Okay? So those are, and then in children or adults who are old, who are able to tell us what's going on, oftentimes they'll complain of neck pain. So those are the things you need to be aware of. Okay? My recommendation is for every person with an MPS disorder that they have lateral flexion extension films done at least every 1 to 3 years, depending on which disorder they have. For Hunter syndrome, really you don't get instability. They can get stenosis when they're quite a bit older, but usually it's teenage years or above. But if it's MPS 6, MPS 1, MPS 4, they should have lateral flexion extension views, which is basically we take a X-ray from the side, have all the way down and all the way up, and what that tells us is whether the bones move on each other when they flex and extend their neck. An odontoid view, again, we want to see that odontoid process, make sure it's developing, make sure it hasn't broken off. If you see a fracture of that odontoid process, then those children are at much higher risk for instability than those that don't. And then, when to get an MRI is a little bit controversial, but to be honest, I'm getting pretty close to saying every child should have an MRI at least once every year or two. I think, because we are starting to find pretty significant cervical spine problems in completely asymptomatic children, and so this is, again, the cervical spine injury can be life-threatening, so it's not something you want to bury your head in the sand about. And the problem, obviously, with MRI is that it requires sedation. So, that's always been, for me, the challenge. You don't want to every year submit these kids to an unnecessary sedation. But I think I'm almost coming to the conclusion that it's important enough that you have to. And all of these ideas, for me, are continuously evolving. And I'm becoming more and more conservative the longer I go in terms of, it scares me. And so early on I was like, oh no, you don't, I'd rather not have sedation. So I know what that's like, how scary it is to have your child sedation. So when do you need cervical spine surgery? Well, in Morchio, it's actually been suggested that all children have their cervical spine fused at age 4 to 5. I think that's really aggressive, and I don't think that's appropriate. There are individuals with Morchio syndrome who never have symptoms throughout their whole life, or don't need any surgery until they're 38, 39, 40 years old. So I think just going in and saying, well, you have Morchio, so you're 5 years old and you need to have cervical spine surgery is a little aggressive. Clearly, the issues that I mentioned with the myelopathy, the neurologic changes, so weakness, clumsiness, bowel bladder changes, sensation. If there's any of those issues and an MRI that says yes, there's something wrong with cervical spine, then that's a clear indication for surgery. That flush that we saw in the one MRI, the spinal cord, surgery, okay? Or if there is clear instability, the bones are just really moving on each other, and basically right now I'm saying 8 millimeters of motion is probably an indication for surgery. If they have any, if they have any of these sort of neurologic changes or MRI, then usually it'll be much. It can be less than that, but if these things are going on, you have to stabilize the spine. Clear instability without any neurologic changes, it becomes a little bit of a gray area, but you just have to understand that if your child has instability, but they don't have neurologic changes, they're not going to be paralyzed tomorrow. And what I hear from a lot of parents is, well, I went and saw the neurosurgeon or the orthopedic surgeon, and they said I need to have surgery tomorrow because if I don't, my child's going to be paralyzed. And well, that makes you feel great as a parent, right? So, and then they come to me and I'm like, well, yes, your child's going to need surgery, but we have time, we can work things out. Let's get things squared away. Let's see your pulmonologist, your cardiologist. Let's square things away because, and then just be careful. It's a little bit of a risk, but not much. It's more risky to run into surgery with an MPS child than not to be close to, I think. Okay? So that's the cervical spine. So I know that's a lot of information about it, but I think the cervical spine by far is the most important problem we deal with because, again, it's either life-threatening or it can cause paralysis, and both of those are issues that are ones we don't want to encounter.